Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. You're going to love today's show with functional medicine doctor Vincent Pedre. He has some amazing information about healing the gut, and I know you will just love it. I wanted to share an email I got. I love emails from you guys, from the listeners. They often bring me to tears. And this one from a listener that I received a few days ago, I got permission to read it. I won't share their name. And they actually were really excited for me to share it because they wanted to spread hope. They say, "Hey there, Ashley. Hope the start of your holiday season is treating you and your family well. I just wanted to send a sincere thank you for the incredible impact you and your podcast has had on my life. After struggling with nervous system issues, digestive system issues for over 5 years, after a concussion landed me in the ER, after years of bouncing around to numerous practitioners and following countless protocols and spending way more money than I'd like to admit, it was 2 episodes of your podcast in particular that introduced me to the missing links in my healing process. I was able to locate an Atlas orthogonal chiropractor in Seattle after hearing your episode with Dr. Patrick Gallagher, and I have been to see Eric Thornton, who literally put my brain back in place. I imagine you get loads of emails like these, but I just wanted to extend my appreciation and gratitude for you and your work. All your shows are so jam-packed with valuable information that I will continue to listen, learn, and pass along the information. Many cheers and hope you have a very happy and healthy holiday." Thank you so much for this letter. I wanted to share this because this listener had spent years and years, over 5 years, going from doctor to doctor with all kinds of issues, and they didn't give up hope, and they kept educating themselves. And through some wonderful episodes, it really unlocked what they were looking for. And I've had similar emails recently saying that specific episodes were the missing links, that they were searching and that something just clicked, and that was the missing link. Sometimes it's diet. Sometimes it's really simple, like removing one thing out of your diet. Sometimes it's a nutrient deficiency, something as simple as magnesium or zinc. Sometimes it's taking the time to breathe. Something really simple. And sometimes it is a lot of things, and it's the shotgun approach, needing to do many changes. If you're suffering and you are feeling sick and you're tired of feeling sick, know that there's hope. Keep moving forward, and every little change matters. Today is, you'll look back and you'll realize today you're better than the day before. That's how I was. I was so sick for so many years. And now looking back, I can't believe it. I can't believe how sick I was because I feel so good now. But it took me years to build this, and it's a foundation of health that you're building. So it's funny that this listener wrote this about having a concussion, because in today's interview, Dr. Pedre talks about one cause of gut dysfunction is concussions, and he explains that. And concussions are really common and often overlooked by regular doctors. When I say regular, I mean just like, run-of-the-mill doctors, not ones that have more advanced training like in functional medicine. So you go to an average doctor and they wouldn't know when you're having digestive issues to actually look at your brain health. Very interesting. So you'll enjoy today's interview if you have gut issues that you're looking to heal, because Dr. Pedre has a wonderful book called Happy Gut, and he teaches and brings us some great information in today's interview. And he's going to come back on the show because even after 90 minutes, we were just scratching the surface, and I'm very excited to have him continue to come back and teach more and more. I want all of you to have wonderfully healthy guts. That doesn't sound good. I want all of us to have wonderfully healthy tummies and happy, healthy tummies and digestive systems. So enjoy today's interview. Please share this episode with those you love who you also want to extend having healthy tummies with. That would be great if we could include all of our loved ones to have build healthy and happy tummies with us. Enjoy today's episode and have an excellent rest of your day. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 397. I am so excited for today's guest. This is a topic that is near and dear to my heart and my gut. We have Dr. Vincent Pedre, who is an MD that specializes in healing the gut holistically. Oh man, your bio, we could spend 2 hours just talking about your bio and your credentials. You have been on some amazing TV shows. You've hung out with Dr. Oz. You've done so many interviews. You've written so much great articles and books, and your website, happygutlife.com. I'm really excited for us to talk about this today because so many people complain. A lot of my listeners complain that they have bloating, they have constipation, that they're on medications for heartburn, that they just don't know where to start. Or maybe they've been trying to do some kind of diet to heal their candida or heal their small intestinal bacterial overgrowth, but it's such a long path and they're not getting the results that they want to get. And gut health is the foundation. If we don't have our gut health, we don't have anything. Because if we're not absorbing and utilizing our nutrition, everything falls apart. So
Totally.
That's where it all begins.
Totally. Yeah. I mean, and thank you so much for having me on your podcast. I like to think of the gut as the root system of the body, the same that the roots are for a tree. They are foundational. So imagine, the health of the tree is guided by the health of the roots. And same way, the health of the body is really dependent on the health of your entire digestive system.
Absolutely. Yes. And then more recently, people have been talking about how they're seeing a direct correlation between gut health and brain health, that the vagus nerve can become inflamed. And they're seeing that also the gut, that we make some of our neurochemicals in the gut, and that even our T3 is converted, the 25% of our T3 is converted in the gut. So the gut is not just for digesting food, it's also affecting our brain and our hormones.
You could say it's a metabolically active organ system that is involved in making, if we include the gut microbiome in that picture, is involved in making neurotransmitters. It makes its own hormones that affect things like your appetite and also your sense of that you've already eaten enough. And yeah, I mean, it controls so many things. It regulates blood sugar. So it's a really integral part of the entire picture of what makes up our health.
Now, you wrote a book called Happy Gut, the cleansing program to help you lose weight, gain energy, and eliminate pain. I heard about the study where they took obese mice and mice of a healthy weight, and they gave they did a fecal transplant from the healthy weight mice to the obese mice, and the obese mice then became, without changing their caloric intake, the obese mice became not obese.
Yeah.
So they're saying that even our gut health has to do with obesity, and since we're seeing that is one of the largest health problems occurring today, would you say that gut health is and that almost everyone doesn't have gut health right now?
Wow. You could argue for that we are in an epidemic of gut disorders, let's say, and gut-related disorders all throughout the world. And, it's fascinating because I teach, I've had the honor to teach in Australia and Mexico. I just came back from Peru. And obesity is a problem that is a worldwide problem, and the rise in diabetes and metabolic syndrome, which is a precursor to diabetes, that's growing all over the world. And you could argue that, which is the chicken or the egg, what's coming first. There have been so many changes in the way that we eat. Our dietary patterns are so skewed from our ancestral patterns because of the availability of food, but also just the preponderance of sugar-laden foods or refined carbohydrates, packaged foods, all sorts of things that are convenient, but they're just not healthy for us, and certainly not healthy for the gut microbiome, which then regulates things like how your body processes sugar, and that's going to relate to how much fat you pack into the middle of your body, because that's regulated by the hormone insulin. So, I mean, you could argue, I mean, look at just the trends. For example, the second most prescribed medication worldwide is a proton pump inhibitor, which lowers the acidity of the stomach. Now, if you just look at this just as a lay person, or even just kind of like an innocent child just asking questions like, weren't we made to have acid in our stomach for a reason? Is it okay to go in and alter that and think that we are solving a problem without creating downstream problems? And that was my question in the 90s, when the proton pump inhibitors became like the new panacea for gut issues. If you had acid reflux, let's give you a proton pump inhibitor. And even back then I asked the question, our physiology evolved to have a pH in the stomach around 3. We evolved to create stomach acid. Why is it okay to change that? And are you sure that by changing that, we're not causing some downstream problems? And, early on in the days of the early days of the proton pump inhibitors, I mean, I swear, if you spoke to a gastroenterologist, they thought it should just be added to the water, that there were no problems with it.
Oh my gosh.
And we know now, more than 2 decades later, that they lead to all sorts of things like calcium malabsorption, iron malabsorption. They can cause B12 deficiency. They lead to low bone mass, eventually maybe to osteoporosis. I mean, come on.
Wouldn't it also lead to something like H. pylori and allow for other like parasitic infections to occur? Because if we don't have enough acid in the stomach, like that's our line of defense. That's kind of like a moat around a castle. It's preventing stuff from getting in, right?
Yeah, so it's the initial line of defense against, let's say, bacteria that might get through the food that we eat, or yeast, for example. Candida has a hard time surviving stomach acid, but if your stomach pH is raised, then it's much easier then to colonize the stomach and really the small intestine and large intestine with yeast. H. pylori is a different story, because PPIs actually inhibit H. pylori, slow down the growth of H. pylori, but they don't eradicate the infection. So they can actually, they could actually perpetuate an H. pylori infection at a very low grade, but never fully get rid of it.
That sounds like you could insert that into almost any condition where chronic drugs are given to mask how the body functions, to sort of manage symptoms but not solve the problem. It persists. Something persists.
Exactly. And for many people, we're starting with stomach acid. For many people, acid reflux, heartburn, is both an issue of diet and lifestyle habits, but it can also be an issue with not enough stomach acid production, which is counterintuitive. So most people think that acid reflux means you're making too much acid. But really, for the majority of people, what it means is that they're making too little acid, and they're probably not making enough stomach acid because there's different levels of malfunction. They could be nutrient deficient, so maybe they don't have enough zinc in their diet. Or, for example, they could have vagal nerve malfunction, and thus they're not getting the nerve impulses that would stimulate the stomach to produce enough acid to break down protein.
What would cause that? What would cause vagal nerve malfunction?
Probably the easiest thing to understand that could cause that is a concussion, for example.
Mm.
How many people have had concussions in their life where
Mm-hmm.
they lose consciousness and they recover from it, at least they think they recover from it, but then something is not quite right after that. We know that if you have a concussion with loss of consciousness, that within 30 minutes you have vagal nerve malfunction, and because of that you get leaky gut syndrome. So the vagus nerve also regulates the gut barrier and the permeability of the gut. But the other thing that I see in my practice that is more common than concussion that causes vagal nerve malfunction is stress.
Mm-hmm.
And I would say that's the number one reason people are, just think to a time when you've been really stressed and you eat, but that food feels like it just sits like a rock in your stomach,
Yes.
right? I mean, that's because you're not making enough digestive enzyme. They say in order to you have to rest to digest. Or in other words, you have to be in a relaxed state in order for your body to be able to digest food. If you're not in a relaxed state, your body thinks that you need to be ready to run because something's going to come and attack you.
Mm-hmm.
That's the state of our modern lives, is that it's maladaptive stress response because we're not out in the wild. We don't need to protect ourselves from some animal that's going to try to attack and eat us, but we're living in a state as if it exists, and we don't resolve that state. So a lot of people live in that chronic fight or flight response, and that will then affect your vagal tone. That reduces vagal tone, and in terms then has the cascading effects of reducing stomach acid production. You might get stomach aches, maybe you start getting some reflux, and then you think, well, I'm producing too much acid, so I should take one of these acid lowering medications. And for the most part, that is the wrong thing to do. And now you're going to create new problems. Because once you're reducing stomach acid, I mean, I mentioned calcium malabsorption, B12. They've also found that people who take PPIs long term, so proton pump inhibitors, these acid reducing medications out there, that they're an increased risk for pneumonia.
Oh,
And
wow.
for being hospitalized with a pneumonia. And they are also at increased risk for an infection that you never want to get, which is C. diff diarrhea, which is caused by a bacteria called Clostridium difficile, which is extremely difficult to treat, has become more and more resistant to the classic antibiotics that were used for that because of the overuse of antibiotics. So it's something that you don't want to get, along with yeast overgrowth. And potentially, I had a patient who came in who developed SIBO as a result of being on a proton pump inhibitor.
Mm. There just doesn't seem like there's any positive news when it comes to taking these medications. They get temporary relief, but they're going to have worse side effects down the road.
Right. Right. So it's either, the quick solution versus what is going to be a little bit harder work, which is figuring out, okay, you need to look at yourself, change your lifestyle. Maybe you're coming home at 8 p.m. at night, eating dinner, and then you're in bed by 11. So you haven't had enough time to digest your food. And then at nighttime, that food is sitting there, putting pressure, and stomach acid comes up because you're lying down. So, a lot of times it takes making some tough choices about changing lifestyle habits. And a lot of people, they'd rather just take a pill than change lifestyle. But honestly, the lifestyle is what's going to have the most favorable effect overall. I mean, the other thing is not breaking down protein properly. So we started talking about neurotransmitters and hormones and whatnot. If you don't break down your protein properly, you're not going to have the substrate necessary to make the neurotransmitters that help keep you happy. and help life feel satisfying. So then, you can go down the path of depression and anxiety because you're not breaking down your protein properly.
I've been advertised to recently, Zantac, which is an antacid and antihistamine, there's a big recall because it's now
Hmm.
linked to causing cancer.
Well, let me explain it. So there's an ingredient in there. Um, the scientific term for it's an inert ingredient that's used as a filler to make these tablets.
Okay, so it's not that
So that
antacids directly
so
cause cancer.
no, it was an ingredient within Zantac, and it was a lot of the generic manufacturers. And it was actually a recall that affected other generics as well, because I have patients who take blood pressure medication
Mm.
that was also within that recall, and it's because they found that it had an ingredient that had an increased suspicion of increasing the risk for cancer in people.
Ah, got it.
So it was basically not the active ingredient itself, but another ingredient in which is scary, because these are over-the-counter medications that you can just go and buy without a doctor's prescription,
Mm-hmm.
and it had a substance in it that has been found to increase the risk for cancer.
Oh yeah. Well, I mean, we live in a world where we feel that because it's sold over the counter, it's safe. But if you go to Costco, you can buy one purchase of cough syrup because they sell this two, so that there are two bulk giant. Um, it's like half a liter, I think, or something. It's some crazy amount of cough syrup, and it's strapped. They're strapped together, but two bottles of this big cough syrup. And if you were to accidentally, because you don't, maybe you're just sipping on it, or you have a cough and you don't read the label, you could kill yourself. That it has a lethal dose of acetaminophen in it, and it's sold over the counter. Like, we can go to a drugstore and buy something that doesn't seem excessive, and kill ourselves. So we have to, like, really, really, really be careful taking any medication at all, and make sure that we're talking to our doctor and doing our research, and, like you said, stopping and looking at lifestyle and diet.
Yeah, but I mean, just think, a lot of doctors are trained within the system, and
Mm-hmm.
I hate to say it, but I was trained in that system
Yeah.
that in some ways, and this is what really turned me off to medicine at the end of my training, is that we're just glorified reps for the pharmaceutical industry. That's the way they train us. We're constantly being marketed to by the different companies. And back in the day, in the early 2000s, we were wined and dined. And,
Mm.
and they found that doctors that were visited by pharmaceutical reps with the newest, most expensive drugs tended to prescribe those newer and more expensive medications, when maybe there were alternatives that were much cheaper that have been out for a long time. And obviously the push is always to sell the newest, because those are the medications that are on patent and the companies are going to make the most money with. So, it's horrible to say, but in some ways I feel like until you wake up as a doctor, you're basically a glorified rep for pharmaceutical companies writing their medications.
This is so refreshing because normally I'm the one that gets on the soapbox and starts ranting and raving about the allopathic medical system, but I decided to just hold back, and you just filled in everything. It was perfect. I love it.
And I can say that now because what I do, and as much as I'm talking about the system, medications can be life-saving.
Sure.
There are definitely places where medications can help change the course of a disease that has gone too far to be able to make an immediate change by using natural means. But even when, and even with, because I sit on both sides of the fence as an internal medicine trained doctor, but also functional medicine trained, I kind of meld the two, and there are places for each. But I'm always, regardless, having a conversation with a patient about nutrition, about lifestyle, about stress management, everything that I think builds good health, because a medication is not going to build good health for a person. It's going to be lifestyle. It's going to be the way they eat.
Mm-hmm.
That's what's going to build good health for people.
Exactly. Exactly. And the thing is, by the time they go to get on a medication, they're really sick of being sick, and they're sick of that symptom, and they need some relief. And pain is the biggest motivator. We will do when we're in pain.
Anything that makes us uncomfortable,
Mm-hmm.
right? Anything that makes us, but thank goodness for podcasts like yours that are out there educating people, because if you think about it, 20 plus years ago, pre-internet age, the place that people got their medical knowledge was from doctors who were trained to prescribe medications
Mm-hmm.
and to treat disease with band-aids rather than to look at the root cause. So now we're in an era where information is wide and open, and you would probably chuckle if you saw what's the sticker that's on the side of my computer that faces my patients. Because I and I think it's funny, but I also respect the free flow of information and the searching that this has created, and has really, the last 20 years have really, I think, empowered patients to see that they had play a bigger role in their health than they were made to believe by our paternalistic allopathic medical system. But my my sticker says, please don't confuse your Google search with my medical degree. And and as I say that, I still encourage people
Yes.
to be their own doctor. And part of what I do with my patients is I teach them to listen to their body and to basically evolve their own intuitive awareness of what is right for them and what is wrong for them. Because I think a lot of people are moving through life, and we're talking about gut health here, and just think the gut is the intuitive center of the body. It's really about tuning into your body and seeing, if you eat this, how does it make you feel? And if you don't eat it, do you feel better? Do you feel more clear-headed? And some people really are not living with that level of awareness, and they're feeling horrible, but they're not connecting the two together, that the way they're eating is part of the reason they don't feel that great.
About 2 years ago, I started to get this sore throat, and my glands were swollen. And I went to my naturopath, and she did swabs for everything, and everything came out negative. And it was so weird. I'm like, what's going on? I didn't feel sick other than my glands were swollen, my adenoids, and my throat was always sore, just out of nowhere. And it was around February. So I thought, okay, I've got to have something, some kind of bug. I was taking all these, herbs and stuff for antiviral and antibacterial. And I went again a few weeks later. I said, this is ridiculous. Like I got to the point where I couldn't do interviews because my throat was so sore. My voice was so sore. She was swabbing me, checking again, nothing. Everything came back. All the cultures came back negative. And she looks at me and she goes, this could be heartburn. And I thought, there's no way this is heartburn. I eat so healthy. And she says, okay, let's do a test. And she doesn't think that Tums are a healthy thing to take, but it's an easy diagnostic tool. It's the cheapest diagnostic tool. She goes, take Tums for 3 days. And if you get relief and your sore throat goes away, then we need to look at your diet. We need to look at what's going on. Sure enough, within hours of taking some Tums, my sore throat starts to subside. And I thought, shoot, are you kidding me? That heartburn can appear as just a sore throat, not like, it doesn't have to be that classic like sensation in the tummy or in the esophagus. And I figured
Definitely.
out that because I was, my husband went vegan, like whole food, plant-based, and I was trying to adapt to that way of eating. So I started eating tofu at every meal. Because I hadn't really learned yet how to do this, way of
Hmm.
eating. And my body was going, what are you feeding me? And my body was giving me, heartburn from eating tofu. So I cut tofu out, and it all went away. And then I had to learn that I can eat, lots of beans and peas and nuts and seeds and all other kinds of food for fiber and protein and all that. And now I can eat tofu once in a while and I have absolutely no problem. But it was like sort of the daily eating it at pretty much every meal. My body went, this isn't happening. But I thought that was really interesting because if I had gone to an MD, I don't know, they would have put me on, they would have started probably with antibiotic because I had like classic, it looked like an infected throat. And then maybe later
Hmm.
on, I would have been put on some antacids, and never looking at adjusting the diet. Whereas going to
Exactly.
you, the functional doctor, you would have started with, okay, what's going on in your life? What's going on in your diet? What changes have you made? How's your stress level? What are you eating? You're
Exactly.
looking at the root.
Yeah, exactly. We're looking at a much bigger picture of, where the symptoms are coming from.
What can people do if the listeners are currently on antacids and they want to get their gut to the point where it's making healthy levels of acid and they no longer have those
Mm,
painful symptoms? What kind of steps can they take to get themselves so healthy that they no longer need that crutch?
that is a really great question. And it can be tough for some people. The ones that I've had that are the most challenging. And part of it can be also belief system. If you've been on an anti-acid medication for over 10 years, you've kind of learned that you can't live without it.
Mm.
So the first part of it is changing the mindset around that, because there is almost like a psychological dependence around taking the medication. Because if you don't, you're going to have acid reflux and you're not going to feel well and you're not going to be able to eat. But if the way I used to do a presentation where I showed a picture of Hoover Dam, and that was my analogy of a PPI, is that it basically slows down the acid production. It's blocking those proton pumps. But the body, as a response, hypertrophies the proton pumps. So it actually makes more of them, but then they're all getting blocked, right? So now say you stop taking the PPI. So now you have more proton pumps than you had before. So guess what's going to happen?
Is it like a flood?
So you're going to start producing too much stomach acid.
Oh my gosh.
So you stop the medication, you feel worse, and then you think, well, that means I can't be off of this medication, right? So a lot of the work that I do with patients is that transition point, which can be a multi-month process. It could be a 6-month process. And a lot of times involves looking at, full lifestyle, because we started talking about the role of the vagus nerve and stress and how that affects stomach acid secretion, and how acid reflux is probably for the most part, low stomach acid, not high stomach acid production. And yet, yes, it does respond to going on a PPI because it raises the pH of the stomach acid. So if it does come up, it doesn't bother the esophagus. You don't get those heartburn symptoms in the same way. So the transition can be tough for some people, but very slow taper of the medication. We don't go from on to off, knowing that there is a hypertrophy of those proton pumps, and that if you stop it suddenly, you're going to get a flood of acid.
Mm.
And then we work on giving them nutrients that help heal the gut barrier. A lot of people are zinc deficient, and zinc is very important for the health of the stomach lining. So we may supplement with some zinc carnosine. A lot of times use combination supplements with marshmallow roots, slippery elm bark, aloe, DGL, which is a licorice derivative, deglycerinated licorice. And then we might also start, and this is so counterintuitive and hard for people to understand, I may start to introduce a hydrochloric acid supplement with
Yeah.
meals where they're eating protein. And that's to help them break down the protein better, right? And a lot of times, that's the hard part for a patient who's been used to like being taught and told that you're producing too much stomach acid. Now I'm going to give you more stomach acid. Like, well, how is that going to make me better?
But they were taught a lie. They were
Exactly. Yeah.
they can for those who don't know the physiology of the esophageal sphincter, isn't that why they get GERD because they weren't producing enough stomach acid, so the sphincter wasn't closing. The sphincter's triggered by a certain level of acid. Can you
That
explain
is
that?
that is part of the picture. And then you have to think about all the things that people might be doing
Mm-hmm.
that weaken or relax the lower esophageal sphincter, which is the protection from that acid coming up. For example, chewing gum excessively, or eating too much chocolate, or drinking a bunch of coffee, or smoking. So all of these things affect the tone of the lower esophageal sphincter, and then that can also allow acid to come up.
Does stress or the vagal nerve malfunction also affect the lower esophageal sphincter?
I'm going to say it has a stronger influence on what's happening in the stomach.
Mm-hmm.
And it probably has some level of effect because stress definitely can affect the ability of the sphincter to contract or relax. Yeah. But it's probably the bigger role is its effect on stomach acid production.
Got it. So someone's stressed out. So one of the listeners, busy mom, stay-at-home mom,
Mm-hmm.
or a guy that one of the listeners is a male and he rushes off to work, or a female who has to manage their taking care of their elderly parents and a job, and just they're basically burning the candles at both ends. So they're stressed. Maybe they've had a concussion in their past. Who knows? Concussions are really common. So they have that. They've got the stress. Maybe they've had in the past few years, they've had some antibiotics that they've been on. So their gut
Mm-hmm.
flora isn't that great. Maybe they have, like you said, a nutrient deficiency of zinc. So they've set up this perfect storm, and maybe they're sort of so tired that they're pounding back the coffee just to like be able to get through
Right.
the day. So they have some like adrenal
Exactly.
exhaustion going on. And now they start to get this heartburn. So they start popping these over-the-counter medications,
Tums or
Tums,
yeah.
whatever they're doing, which is lowering stomach acid because that gives temporary relief. But what that does is it persists the problem of malabsorption of nutrients, might even allow for candida overgrowth or other dysbiosis to occur. Now they're having more and more symptoms. So then it just grows and grows and grows and grows.
Yeah, so you see like this is like a snowball or avalanche effect. It
Yeah.
starts small, and then before you know it, you feel sick,
Mm-hmm.
you feel fat, and you feel like you're bloated and you don't have energy for anything, and you're supposed to be this super mom.
Yeah. And is really hard because I can only speak for my experience as a woman. We will put the oxygen mask on everyone else first. And especially when we're a mom, and especially if we have family members who are, in need of help. Like right now, so many baby boomers or even our grandparents who are still around need us. So we're taking care of a lot of people, and then we have to pay the bills, and we sometimes put our needs last, and sometimes we self-medicate.
Sometimes, or a lot of the time, I have such respect for what women do in the world, and you have to hold so much space for so many things. And we're in an era where it's just in many ways so difficult because it would be much simpler if you're a mom, um, to stay home and take care of the kids. But I have a lot of working moms that have a child. They're giving 3 months maternity leave, which in my opinion is not long enough.
Yeah.
And then they have to say goodbye to their baby child, leave it with a nanny, or, in best case scenario, it's the mom or, family member, and go back to work. And now they're supposed to work full time, maybe pumping breast milk. And I feel like it's a huge load on women, because you have to be like superhuman. And that is a huge stressor, huge stressor. And then, of course, we talk about the snowball effect of stress and how that affects the body, but it affects the gut microbiome. It affects the way the gut functions, from acid production to digestive enzyme production to the permeability of the gut, and also to the makeup of your gut microbiome. All of that is sensitive to the stress signals within the body.
So many listeners are really intrigued by what's the perfect diet, right? Like, what should I eat? What should I eat to be healthy? And I keep saying there's no one perfect diet for everyone, right? Because if an athlete, a 40-year-old athlete came in versus a 70-year-old woman with osteoporosis versus a 20-year-old with a recent diagnosis of type 2 diabetes, like those three people might need a different nutrient plan, right? They have, they have different needs. Their body, one person might be in a histamine response and in great amount of inflammation, whereas the other person might have a zinc deficiency and a calcium deficiency, right? So there's not one perfect approach, like one diet that fits all, but diet isn't the first thing we should be asking. What you're sharing is like really gut health is the first thing we should be asking. Do I have gut health? Because if I don't have gut health, then it doesn't matter what I'm eating. My body's not digesting and absorbing it.
And it can be problematic, because you could think that you're being super healthy, eating lots of salads, raw vegetables, and if your gut is disordered, so you don't have the right microbiome to break down those very difficult to break down plant cell wall fibers, then you're not going to feel well. And perhaps in that moment in time stamped, you would do better with cooked vegetables, healing the gut microbiome, healing the production of digestive enzymes, and then over time, then segue the diet back towards a mix of cooked and raw, or maybe just lightly steamed, so even what is the right diet is not just what is the right diet for you as an individual, but what is the right diet for you now.
Mm-hmm.
And, you almost have to put that also in a timeline, because the right diet changes, but I do see general trends. I mean, we know that the more plants you eat, in my opinion, and that's what the science has showed, is that it's better for you. But then there are really interesting studies that have been done, like on the Hadza people of Tanzania, the hunter-gatherers, which I'm so excited because I'm going to be traveling there to meet them.
Oh, wow.
Next year.
Cool.
And there's about a little over 1,000 of them, but at least a quarter still live in their more traditional way, which is eating tubers, berries, the baobab fruit. So they eat the seed and also the meat, the pulp of the fruit, which is very high in fiber. And they also hunt. They eat large to medium-sized animals, sometimes bigger. And they also eat honey. But, when I say that, it's not, you have to take your Western mind out of it. It's not honey that comes in a jar. They're actually going and getting the honeycomb, and they're eating the entire thing, including larvae inside.
Wow.
And their gut microbiome, when they've done tests, they've done PCR testing, has a much greater variety than in one study they looked at Italian group of control. And you can imagine an Italian diet, pasta and meat dishes and, lots of fresh tomatoes and vegetables from the garden. And their gut microbiome was not as diverse as the Hadza people. So you ask, okay, what is the missing element? The Hadza are certainly not eating a diet that is as varied as the Italian group. So why do they have such a diverse microbiome? And probably part of it is their contact with nature and living out in the wild and contact with dirt. And so they're not living in this hygiene, over clean environment. They're not washing their hands when they come home from hunting, and maybe they have some blood on their hands, before they hug or kiss their wives. And, so that's something else to look at, is a missing element of just being connected with nature, being out there. So that's part of what builds diversity in our microbiome and creates healthy gut.
I'd be really interested to know that what do they incorporate in there? So when you go there, remember this question: what do they incorporate as an anti-parasitic? Because when we look at traditional ancient cultures, they have, like in India, Mimosa pudica seed, for example, is used commonly to deworm. Eating pumpkin seeds deworms, right? So that was normal. Like 100 years ago, it was normal for farmers twice a year to deworm their animals, and the farmers would take the same herbs themselves. That was normal. So I'm wondering, like, what do they do to deworm themselves? Like, is it the honey? Like, what is it that's just cleaning them out? Because parasites, they happen.
Exactly. And also the question is, are they living in a different state of balance with parasites than people in the West do? Because of slightly different composition of their gut microbiome. So I will keep that in mind. I'm like, it's so crazy to me that I will be out in the middle of the bush in Tanzania.
Awesome.
And get to live and spend a couple of days with them in this very small group. I mean, it's going to be really amazing, because I've been looking at their microbiome and the studies on that and seeing, it's just a big curiosity. Like, why do they have such a diverse microbiome, and how do they, they have no diabetes, they do not have cancer.
What do they die of? I mean, when it comes to illness, what do they die of?
They die of a lot of times from accidents. Funny enough, and if there might be some infant mortality, but otherwise, if they don't die in a young age or because of an accident, they live into their 60s, 70s. So, not as long of a lifespan that you would think, but still pretty amazing for a hunter-gatherer.
I'd be really curious, though, when they die in their 60s or 70s, what illnesses do they die from? Is it all heart disease? Is it all infection? Like that, it would be interesting to see the correlation between their lifestyle and then what they die from.
That would be another question for my research when I go.
All right. Well, I want to have you back on the show after that trip, because I want to hear all about it. I think that sounds fascinating. That is a true, our Aboriginal diet, right? That's like if all of us were picked up some reality TV show and threw us on an island, like that's how we'd have to eat to survive. And
oh my gosh, and can you imagine eating like
larvae and honey?
Eating honeycomb? Like that would be
I think my 4-year-old would fight me for it. I think he would be so excited. He has this fascination with insects, and I don't think he would mind eating them at all. So there has to be something primal in there.
There's a lot of nutrition in the honeycomb and helps support the gut microbiome. It's also interesting how they've looked at their microbiome over time as it as they go from a rainy season to a more dry season.
Mm-hmm.
And during those two different seasons, their diet skews in one direction or the other. And they see that there are parts of the microbiome that appear during a season because they're being fed by, let's say, the honey. And then when their diet skews in another direction, that part disappears, seemingly disappears, but then it comes back the next season.
Yeah, isn't there like a whole season where all they eat are tubers for a few months and that their microbiome adapts for that?
That is a really big part of, at least my understanding, a big part of their diet.
Mm-hmm.
And also, interestingly, when they wean kids off of breast milk, what they do is they create a porridge from the baobab. The baobab is, it's kind of really hard fruit. It's got a lot of fiber inside, and they grind that up and they make a porridge out of it. And the kids are getting like anywhere between 50 and 100 grams of fiber a day.
Wow.
Now, their bellies will be a bit distended because that amount of fiber is going to produce a good amount of gas, which I think about, because in the West, we don't want to be distended. We don't want to look fat. And for them, it's like, yeah, it's whatever. It's part of, but in comparison, the average American gets about 10, maybe maximum 15 grams of fiber in a day, just to put it in perspective.
Mm-hmm.
And the recommended amount of fiber that we should be eating is anywhere between 25 and 35 grams of fiber. And yet the Hadza are eating up to 50 grams of fiber per day.
Mm-hmm. Can we eat too much fiber? Is there ever a point where it's like, 100 grams of fiber is dangerous? Or, I mean, as long as you're consuming enough water and you feel fine and you're not hurting, like it's okay to have 100 grams of fiber?
Yeah. I have a feeling if you had 100 grams, you would be really bloated and uncomfortable. I mean, the danger is you get really stuck inside, constipated, because you're not drinking enough water with the fiber, or maybe you're not getting enough healthy fats to kind of lubricate things and help move things along. So I always think it's important to be careful to make sure you're balancing out nutrients.
I made this chia seed pudding. It's amazing. It's it tastes exactly like pumpkin pie, and my husband swears he can taste the crust in it too. It's kind of like something Willy Wonka would make, where you taste like an entire pumpkin pie with the crust, and there's a ton of chia seeds in it, and a ton. So your gut is getting so lubricated. But it tastes just like pumpkin pie, and it's great for breakfast because it's so filling and such good fiber in it.
Oh my God, that sounds so
I
good.
will give you the recipe. Actually, it's I'm launching a membership called Learn Your Health Home Kitchen, where we're doing cooking videos and teaching people how to cook whole food plant-based. And for those who don't want to give up meat entirely, they can just learn how to have more vegetables and more fiber and more whole foods in their life. But people who want to try to learn how to eat whole food plant-based and experience it, then they can, jump in and do everything. But that's one of the recipes that I'm adding to the membership. We're going to launch it soon. But I got so excited because my son really, really wanted some pumpkin pie, and I really wanted to make something healthy for him for breakfast. And I was just like, I've got a lot of chia seeds and a lot of pumpkin. Let me see what I can do with that. So
Nice.
yeah, but I was just thinking how much fiber is in it. It's crazy. It's a crazy amount of fiber, but you feel so good afterwards. And obviously it's moist, and it's not it's not dehydrating, but you definitely want to drink a lot of water if you're adding chia or flax to your food. I learned that the hard way once. Thought I was safe with just adding some flax meal to my salad, and I didn't drink enough water, and I found out pretty quickly that that's not a smart move. So
No, and it just can kind of condense things in the gut and not let things move. And you definitely want a mix of both soluble and insoluble fibers. That's also important. So you think of insoluble fibers as roughage, so kind of like cleans out the inside of the gut, kind of gets things moving, provides a lot of the fibers that are fermented, and then the soluble fiber, which are things like oats, which then allow for control of how nutrients come into the bloodstream. So they help slow down like the sugars that are getting broken down for the carbohydrates from entering too quickly and causing an insulin spike. So it's important to make sure you're getting a balance of both types of fibers. Apples are another great example.
Yes.
Organic apples.
Organic apples are my favorite. The outside, the peel of an apple is insoluble fiber, and then the inside is soluble fiber.
Yeah, and it's basically you're getting both types of fiber in an apple. And I don't know if your listeners know this, but if you're eating non-organic apples, they are sprayed with up to several different types of pesticides that have up to 40 some different neurotoxins.
Oh my gosh.
So, and if you ever follow the environmental working group,
yes,
the Clean 15 and the Dirty Dozen, you know that apples are very high up on the list of the Dirty Dozen. And anything that has a thin skin, like an apple that is sprayed with a pesticide, is going to be infused with that pesticide. You cannot wash it off. So you should never, if you can choose that, if you're going to choose where do you spend your dollars on groceries, buy organic apples. Don't buy non-organic. You can get them at the farm. I mean, you're in Seattle, so you're like in Apple State, and I'm in New York, which also is a great Apple State. And I think, it's either pay a little bit more now or pay later for the consequences thereof.
So I've told this story before on the show, but I'll share it with you. I was really, really, really sick in my 20s. I was just eating the standard American diet, and I had type 2 diabetes, chronic adrenal fatigue, chronic monthly infections for which I was taking antibiotics monthly. And I had polycystic ovarian syndrome and told by an endocrinologist I was infertile and I'd never have kids. And I spent my 20s on medications and sick and getting sicker and sicker. I ended up actually on medication for heartburn. I mean, the whole thing. And I remember watching, I was also completely stressed out to the max. I was in an abusive relationship. My mom had died. I was very depressed.
You sound like our token patient.
Right?
Like who we're talking about.
Exactly. I was going through the ringer. And, I found joy in day-to-day things, but I was just going downhill. And I was gaining weight, even though I was exercising like crazy, and I'd eat like all the other guys in the dojo. I was doing martial arts 6 days a week, and I would eat like all of them because they look healthy. So I'd go to Subway with them and get like whole wheat, right? And think that's like super healthy. I'm getting whole wheat Subway sandwiches thinking, oh, I'm eating healthy. And of course, then I'd immediately have heartburn after, and then I'd pop the heartburn pills. This is my early 20s when this happened. And I happened to turn on the TV, and there was this show with, I guess, a naturopath, and they were just like some kind of talk show. And she was saying, if you have heartburn, it's too little stomach acid, not too much. Drink some apple cider vinegar and drink some aloe. And I threw away that box of over-the-counter meds and started drinking aloe and started, listening to my body a bit more. And my heartburn went away. I'm like, whoa. And then a few years later, we watched, this is 2008, we watched a documentary on Netflix right when they started doing streaming of videos, and it was some health documentary, kind of like Food Inc. or something. And they said, shop the perimeter of the grocery store and eat organic. And at this point, I was so sick. I'd wake up every morning with a pounding headache, feeling as though I drank a bottle of vodka and got hit by a Mack truck the night before. Like I was out of control sick, and I felt like a prisoner of my own body. I'd cry daily because of how much pain and suffering I was in, because I felt like such a prisoner of a sick body. And so we did it. We went to Whole Foods and we shopped the perimeter of the store and we bought organic. And within 30 days, my chronic infections went away.
Wow.
And I thought the only thing I changed, besides I probably cut out some sugar, like accidentally, because I wasn't buying processed food. I was still eating meat. I was still eating dairy even. And I was eating just fruits, vegetables, meat, and I wasn't even gluten-free at the time. I was still eating grains, but I was just eating more of less processed food, and then cutting out all the pesticides. And it just hit me. I'm like, pesticides were the reason that I
Mm.
was getting these infections. It was like, it was the stressor on my body and my gut. And so when I went organic, that was the biggest shift that happened within 30 days. And then that's what had me keep seeking how to heal my body. And with food and lifestyle changes and supplements, I healed my type 2 diabetes, my chronic adrenal fatigue went away. I got rid of my polycystic ovarian syndrome. I'm now completely free of that. My numbers are amazing. I get regular blood work with my naturopath, and we naturally conceived our child, who is 4, almost 5, and he's super healthy.
Oh, that's so great.
And so that's what, like, shifting to organic, and then shifting diet, shifting lifestyle, looking at stress, taking supplements when, to fill in those nutrient gaps. And that's why I do what I do now, because it's like, I know my listeners are suffering, and I want them to find the answers that they need so that they don't have to suffer anymore, because it's possible, that healing is possible. So that's why I love the message that you give and that what you teach, because you're showing people that they can be free of the suffering, of the heartburn, of the bloating, of the constipation, of the small intestinal bacterial overgrowth, that they can be free of it.
And I've always been, as much as I can be, the type of practitioner that walks his talk, because I also was subject to multiple rounds of antibiotics when I was a
Mm.
child, as a teenager. And I didn't realize at the time, because I was getting 2 or 3 rounds of antibiotics every year. The doctors and pediatricians were telling my parents my immune system is weak. I couldn't gain weight. I was super thin, and I ate probably more than 3,000 calories a day. But I was eating cereal with milk in the morning, and maybe a sandwich at school or a pastry. And then there was bread at dinner. And then maybe there was ice cream after dinner. And a lot of times I used to go and get a milkshake on the way home from school. Uh, and I mean, it's crazy how much sugar and wheat and dairy that I was eating. And I can look back and now say that the multiple rounds of antibiotic were probably the instigator of a dysbiosis, an imbalance of good and bad bacteria in my gut, that then led to leaky gut and allowed me to become sensitive to wheat, gluten and wheat and dairy. And it was over the years figuring that out, because I by my 20s I had IBS, and I just thought, this is just the way my life is gonna be. I'm always gonna have a sensitive stomach, and I'm not gonna be able to tolerate a lot of things. I had to be careful when I ate out, but I never knew what was causing what. And it wasn't until I discovered and started making changes in the diet. But I was always, even though when I was in my medical education and not being taught nutrition, I always just had a gut intuition that, pardon the pun, that nutrition was a big part of the picture. And I was always trying to hack. I mean, it's perhaps a little bit selfish on my part, but I think it really kind of guided a lot of what I've strived to learn, and then that I do with my patients. Was I just, back in my early 20s, wanted to hack, why do I get sick so often, and how can I not get so sick as often? And I was in medical school experimenting with my diet, reduced the amount of dairy in my diet, and then immediately noticed that I wasn't getting sick as often. And without anybody teaching me back then, there was no teaching around dairy and its inflammatory effects. I just had kind of concluded, by being an observer in my own body, that dairy was problematic for me, and I had to be careful about consuming dairy as much as I loved, in my 20s, ice cream.
Who
And
doesn't?
I know, it's still a weakness. And thankfully now there's vegan ice creams and coconut, and
You can get a
there's
Vitamix and make your own nice
low.
cream.
Exactly. I've made avocado ice
Oh
cream.
my gosh, that sounds crazy.
Yeah. So over the years, there was one point when I was in my residency training in New York, and I was going out with my friends and late nights and eating out, and I wasn't feeling that great and I was dragging, and I just told all of them, I'm going to disappear for the next month and I'm going to do some self-care. And I went to the supermarket, I bought organic, I started cooking for myself more often, no more takeout. And within, I kid you not, in 2 weeks, I felt so different. Just eating food that was more vital. And in 4 weeks, I felt great. And at the time, I had also been doing yoga and I had started meditating. And I was meditating like 5 days per week. And when I went back and met up with my friends, they looked at me and they're like, "What did you do? you look you look totally different." And all I did was reduce my stress by meditating and eating right. That was it. So I was
Wow.
listening to your story and thinking, I have a very similar
Yeah.
story. But even then I had not completely hacked the gut issues. And it wasn't until I ran into functional medicine and started learning functional medicine and understanding the role of the gut and the gut microbiome and really the complexity of all that, that I was able to heal my gut. And because of that, I had such a big fascination with gut health and patients who came in with gut problems, because we're really not taught in Western medicine all the potential root causes of gut problems. Maybe we are taught, let me clarify it. We're taught from the perspective of Western medicine, but we're not really taught the root causes, which could be yeast overgrowth, which could be dysbiosis, which could be low stomach acid, which could be not enough leaky gut with damage to the brush border in the small intestine, then affecting your pancreas' ability to produce enzyme because it's not getting the right signals. So I got a much more complex understanding of gut health and all the interconnections and how it's connected to allergies, asthma, migraines, autoimmune disease. And that became a fascination for me. And working with gut patients was just something that I enjoyed. And of course, when you enjoy something, you want to do more of that. And just accidentally, one gut patient would get better, they would refer a friend would get better, friend would refer another friend.
Nice.
And it wasn't like I was out there saying, I want to be a gut expert. It was more like, I'm just pursuing my passion. My
Mm.
passion is helping people heal at the root. And it turned out that that had to do with even my own plight growing up with gut issues. And that was where my book Happy Gut was born from. Was from my own struggles, figuring that out and working with patients and seeing them improve and just seeing what a dramatic difference you can make in people's lives by healing their gut health.
I love it. I love it. So how long have you been practicing functional medicine?
Well, my first conference was in 2006.
Okay.
And soon after that, I started learning and I dove into their advanced practice modules starting in 2008. Because the Institute had not had a whole certification program built out, and they came out with that over that time period. And then I started doing the advanced practice modules. So over 10 years that
Yeah.
I've been integrating that into my practice. And obviously, you gain a lot of you learn it in theory, but then you have to practice it, and you gain a lot of experience by dealing with a bunch of different patients and scenarios. And then as you become more of a recognized gut expert, which I am now, you then get the more difficult cases that come to you.
Nice. Very cool. So my listeners who have really are the difficult cases, if I have listeners out there who feel that they're complex, can they see you? Do you take consultations over Skype, or can they come see you in person?
They can come see me in person. I take very few patients now
Okay.
because as you can imagine, I've got a pretty full practice. But my plan is to next year to bring in a functional trained nurse practitioner who can train with me and start to see Patience, because I recognize, it's like it's just funny how you go from not being known to known, and then everybody wants to come in and see you, and you realize I just can't serve everyone, and that's part of the reason that I wrote my book, because I realized there are so many people out there who need help that I can't possibly ever see in my lifetime, because
Mm.
there's just I'm very much into balance, and I'm very much into also my own self-care, and bringing my best foot forward, which means that I don't work a 12-hour day, and I don't see a patient every 15 minutes,
Yes.
because I believe in quality over quantity, and I think that's what the people who come see me know that I'm about. Is I'll spend a significant amount of time with you, and to me, and like for any doctor who's practicing functional medicine, it's a collaborative effort. So it's me and the patient both facing the path into the future together. It's not the old paradigm of I'm a fatherly doctor and you come in and I give you this medication and you just take that and you don't have to do anything else and you'll be better. No, I give patients homework, but realizing that it's impossible for me to see all the people that I would ever want to help in my life, and I wanted to have a bigger impact. That's why I do things like interviews with you, and give this information for people to kind of hear this and then think, maybe they could do things a little bit differently, or maybe there's something that they could change that could help them heal, or at least start a new conversation with their health practitioner about, what is really going on here, and
Yeah.
are we really addressing the root cause. But yeah, I mean, that's why I wrote my book, because I realized, and partly honestly, I had always, I don't know if you've have felt this, but even from the early 2000s, I started getting this feeling inside that I had a book in me that had to be written.
Yes.
And I didn't know what that book was. I mean, if you look at my files in my iPhone, I've got like so many book ideas that have been written down, but it wasn't until I landed on this idea that was also connected to my own story that it felt authentic enough for me to put the work in. Because doing a book is like running a 50-mile mega marathon. It is a toil. It is a labor of love. It is not for the weak-hearted. Yeah, I mean, you could produce a really short book, but for me, it was like my manifesto. It was like for me putting all my work, everything that I had learned together to teach people how to have a healthy gut. And I don't know why did I get sidetracked on that?
Oh, well, your book and it's a marathon and you have all these you have more books in you, by the way. You're definitely going to write more books. But that happy gut is you've poured your passion into it, and your over 10 years of experience helping people heal their gut, but also your own story, because you know, heal thyself, right? You healed yourself and you walk the walk.
You're always a better healer, I think, when you've had to face your own challenges that have
Yeah.
made you human, because one of the hardest things about being a doctor is being put on a pedestal,
Yeah.
and people think that you're like this superhuman. We were talking about superwomen and supermoms, and in many ways, walking the walk of a doctor sometimes is kind of like being that superhuman, but we are also human. And I have been so grateful in my life for all of the challenges that I've had that have really condensed me into just being a grounded human and understanding things, not just from theory, from learning in a book, but from having lived it myself. I mean, one thing, I don't know if you ever watched Grey's Anatomy.
I
Do you ever
do.
watch? So there was an episode where the chief of surgery I think, was speaking with the woman doctor that was also in surgery. And it was about being a parent. And he said, and this was, I remember seeing this episode when my son was probably 2 or 3 years old. And he said, being a parent makes you a better doctor. And I totally connected with that, because having a child was that first moment of, wow, it's not about me anymore, or it's not just about me anymore. It's about this new life that has arrived. And it really puts you in a place of service, and I look at, for me, my work with patients is almost like in some ways, I almost feel of it like it's almost like the service that a priest does. It's like a vocation, or sometimes I think of my patients as my sheep. It really does require a great deal of sacrifice on our part. But with that sacrifice, and kind of tie it back into, the importance of realizing that at some point the balance can shift too far, and you have to come back and look in the mirror and realize you also need to take care of yourself.
Mm-hmm.
Put your oxygen mask on first, then put on everyone else's oxygen mask. But because what you don't realize is, when you're not doing that, yes, you might be taking care of everyone, you're not doing it as well as you could if you are in your best light.
Right. We absolutely don't take care of those we love best if we're neglecting ourselves. Just like, I mean, it's funny, people will take care of their car more than they take care of themselves. They'll make sure it gets an oil change and all the fluids are topped off and it's
Oh my
clean
God. I
and
mean, I have patients who will cook an entire dinner for their kids and then just order in for themselves.
right. Yeah.
Or they'll cook for their dog, and
Oh.
their dog eats better than they do. Like, okay,
Yes.
if you're taking the trouble to do that, let's refocus here. Let's see, how can we get care back to self. And that was
Mm.
part of the reason that I named the program, when I was trying to come up with an acronym for the program that would be kind of like the system that I use for healing the gut. I called it Gut Care, CARE being an acronym for Cleanse, Activate, Restore, and Enhance. And it's a whole system for healing the gut that I wrote about in my book. But in the bigger picture, it's also care, like caring for self. And I think is so important, because the commonality that I find in patients that come in with gut health issues is, a lot of times they're really putting themselves last.
Mm. So, yeah, I love that you started at the beginning of the interview talking about how the first thing you do to help someone get off of a medication, right, and heal the gut to the point where they no longer need that crutch is mindset. And I think a lot of people will go, "Oh, mindset, whatever, okay." But really, that is everything. I mean, we can actually create a placebo effect or a nocebo effect based on our belief system, based on our mindset.
This is a crazy fact. Patients who feel more connected and like their doctor have better results than patients that don't.
That's that nocebo or the placebo effect. To
It's
if you like your
it's
doctor, then you think it's going to work. And even if you got a sugar pill,
I mean, just think of the blue zones around the world, and you know, the factors that affect the reason that people live past 100. And part of it is a sense of community,
mm,
being together. And that's a very important part of, I think, for humans, of healing, is to feel like they're in community, connected.
yeah.
Whether it's with family, with friends, for some people it's church, for other people it's their CrossFit box, whatever it is. Yeah, but it's a
Yeah.
sense of having community where you feel you belong. I think that's a very important human need, and something we don't often talk about in health is that importance of community. I mean, if you think about it, each individual is a community. We are these symbiotic organisms that some people argue could not exist without the metabolic byproducts produced by the gut microbiome, because some scientists say there are not enough genes in the body to encode for everything that the body needs in order to function optimally, that you also need the microbiome.
Mm-hmm.
And the genetic pool of the microbiome, which is 100 times greater than our own genetic pool, to create metabolic byproducts that regulate and help support the body. And I find that, to me, is super fascinating, because if you only thought that your gut microbiome is one of the most complex ecosystems on the planet, think of it that way. How would you treat that now that you know that within you have this treasure, this really great treasure that has evolved over centuries with us, passed on from human to human, through our environment, through our interaction with nature, that helps support health, or it can be a detriment to health, depending on circumstances like antibiotics, overuse of antibiotics. How do you treat your body? What would you eat if you have this really important internal garden? I think there's a lot of mindlessness that happens with people, and a lot of unintentional eating. They're not really thinking about how they feel and how things affect them. And I think that's really important.
I was just grabbing a few studies that are printed out on my paper, or on my desk. That's why I was making some noise, because what you said goes exactly with. I love the serendipity of this, that I'm holding in my hand some studies on the gut biome, and that they are seeing that the signaling in parasitic pneumatoids, that there's a psychochemical communication between host and parasite, and the endogenous molecular transduction pathways governing the worm development and survival. So that was one, and the other one is parasites, nutrition, immune response, and the biology of metabolic tissue. But in these they talk about, not only are they talking about negative pathogens, right? Like negative stuff in your gut, but basically the gut biome, which could have parasites, right? Not all parasites are worms, right? But parasites, good bacteria, bad bacteria. So anything living in the gut is they're seeing that they're sending signals. There's these studies now that show that they can see that there's psychochemicals being created by whatever is in your gut. Let's say you eat fast food every day, and that's the gut biome you created. Like, you created the Homer Simpson of gut biomes. And that is signaling to you that the gut biome is actually telling you to feed it more fast food, because that's
Right.
what feeds it.
And the most blatant example of that I see in practice is when someone has yeast overgrowth or candida, and they have an irrational craving for sugar.
Yes.
And or for refined carbohydrates. It could be sugar, it could be just comfort foods, like potatoes, pasta, rice. Yeah, so I mean, that's another really blatant example of where it's like, who is in control? Is your brain in control, or is your microbiome in the gut in control?
Yeah, who's craving? Who's having the cravings?
Yeah.
Right. And a dear friend of mine is going through a parasite cleanse right now, because she was having very strange symptoms around the full moon for about 4 months now. And I kept saying, dude, this is parasites. You got to look at this. And she was having like heart palpitations and mood swings and just feeling totally off. But it was only during the full moon, which of course someone might think that's hormones, right? but she's like, it was pretty consistently around the full moon. And so she just started a parasite cleanse and she can tell a difference. And that is just very interesting that the, parasites and even a gut dysbiosis can cause crazy symptoms in the body, but it also can tell us what to eat to feed it. And
Yeah.
that's what I noticed when I started eating whole food plant-based. I didn't love vegetables, but I mean, I didn't hate them. And now when I see kale, I actually have a Pavlovian's response. I actually start salivating. I start getting a little excited. Just like someone might get excited if they see Krispy Kreme donuts, which I will have like a revulsion towards now. I'm
Right.
not even interested. But man, if you made me a kale salad, I'm getting a little happy. I'm actually just salad. My mouth is getting watery just thinking about it. And that's because the gut biome I've created over the last few years is like super happy with eating that way. And so I get like almost a high off of eating these like green leafy greens.
Or you even start to, for me, because I travel a lot and sometimes to foreign countries, uh, when you're missing the amount of greens that I'm used to eating on a regular basis, you start to crave it.
Yeah.
It's almost like and that's yet another level of that intuitive awareness where you sense a craving, but then you actually honor it and you realize, oh, it's because my body needs this.
Mm-hmm. Now we got to catch ourselves though, because if we're having that craving for like processed sugar
Right.
or right.
That's a whole different. And I was going to say, I'm glad that you come back to that, because I was going to say that what I've seen with patients is, and it's amazing, because you can take a person who feels like they cannot live without sugar. And if you can put them on a sugar cleanse, so you take all processed sugars out of the diet and keep them on that, the first day or two, they're going to feel horrible. They're going to they're like, I'm not going to make it through the day. By day 3, they're a little bit better. By day 4, they're not really needing sugar. And by the end of 7 days, they're off of sugar.
Mm-hmm. It's like getting off of heroin.
Yeah, I mean, we know sugar has the same effect on the brain as cocaine. It affects the dopamine pathway, which is the reward pathway in the brain that makes you feel good when you do something. So, of course, everyone wants sugar. The interesting thing, and I know you don't eat processed sugar, you don't eat a lot of sugar, and I'm the same. I find that, I'm dogmatic, but I'm also allow for fuzzy borders, because I think that in my own eating, because I think if we just are strict all the time, that can get a little too much and that becomes a stressor. So, I might be traveling and someone offers a dessert, but I can tell you, if there's too much sugar, I actually feel horrible. I can feel it immediately. My heart rate goes up
Mm-hmm.
as soon as I eat it. So I have the reverse effect. Like, I'll have sugar and I'll realize, you know what? This is not worth it for me.
Yeah.
I don't really. So really, and you heard me unwrapping this earlier, was my dark chocolate from Peru.
Right. I was like, is that a candy wrapper in the background? What was going on? And you're like, well, let me tell you about my 85%
My
Peruvian dark
organic dark
chocolate.
chocolate. Yeah. And that is my go-to, because it's low in sugar. It's not going to bump my blood sugar. It's not going to give me sugar cravings. And it satisfies a little element of sweetness. I mean, there's also, we were talking about the dark chocolate with stevia. And, sometimes I need that little bit of sweet, but I also know if I have something too sweet, it's going to actually feel pretty horrible for me, because once you get your body accustomed to being cleaner, it actually tells you immediately when you step outside of that.
Yes. We just yesterday we were filming for the membership for the Learn to Health Home Kitchen, and we made brownies, whole food brownies, and it's sweetened with yams, with sweet potatoes, and there's raw or organic cacao powder in there. But when you bake them, your whole house smells like brownies. And
Mm,
my 4-year-old, now they're not as sweet as brown, like, as store-bought brownies, because they're Whole Foods. but they taste really good. And my son loves them. He thinks they're the best thing in the world. And if you can get a 4-year-old to eat something that's like healthy and love it, oh man, you're hitting a home run. So he like, that's his new go-to food, between that and the chia seed pumpkin pie pudding.
And
Oh,
what is the base for the brownie?
it's yams. It's those
Nice.
orange,
Yeah.
I call them sweet potatoes, but they're orange yams, right? The
I d-
organic, the big bag of them
yeah.
from Costco is really cheap right now. And we make them in the Instant Pot, and then we blend it with cacao and
Oh,
vanilla and oh, what else? You can put in some maple syrup if you want, or stevia if you want. If you need more sweet, because sometimes you need more sweet if you are, first of all, giving it to people who are not neuroadapted to eating no sugar, and
right.
just help them transition. Or if sometimes yams just are, sometimes they're really sweet, sometimes they aren't. So you just kind of have to play around, like basically taste the batter. But we just blended it, and then you have to.
Japanese yams.
Yes. Oh my gosh. Seriously. Yeah, you could play
Some of
around
my
with the different kinds of
favorites.
sweet potatoes and yams, because some of them are sweeter than others. And then you bake it for an hour, and that creates that brownie crust that is wonderful. It's very, very moist, and but it really does feel like there's flour. There's no flour in it. So,
Yeah,
yeah.
that sounds like a dream. Last year I tried and failed. This was my first try to make black bean brownies
Yes.
for the holidays. Needless to say, my family doesn't share the same zest for healthy renditions of things as I do, and I thought they were actually pretty good, but they did not.
Oh,
Uh,
I love black bean brownies, but one thing I'd say is do 1 can of black beans with between 1 and 2 cups of yams. So that really balances it
yeah,
out.
give it a little more sustenance.
Yes, yeah, and you can add some vanilla powder in there. Um, there's a few things you can add in there, like, some cinnamon, and you can play around with it. And then lots of the cacao powder, which has caffeine in it. So don't eat it late at night. I learned that the hard way. I'm like, why am I so
I
awake right now?
know.
So
Yeah, I have to be careful because usually my desire for dark chocolate is right after dinner. And we
mhm.
know, by the way, the benefits of dark chocolate partly are due to the microbiome
Ooh.
and their processing of I believe it's anandamide in the dark chocolate, where you need the microbiome to convert the chemical in there to a version that is antioxidant for the body. So it's kind of a little fascinating fact.
That's so fascinating. Yeah, it's amazing that the microbiome is needed to convert so much of what our body needs. It really is that garden in our body. We have the most complex garden inside us that is somewhere between, I've heard, between 4 and 6 pounds of bacteria living inside us. I have so many more questions for you. We have to have you back on the show. This has been
I
wonderful.
know
It's
this.
it's been
How
so
did
much
this
fun.
fly? How did this just go by?
I know, it's just
You gotta have
amazing.
me back after I get back from Africa, and we gotta talk
Please.
about
Yes.
the
Yes.
Hadza. That's gonna be so wild.
Oh, I'm so excited. When are you going next year?
February.
Awesome. Okay. I need to
Yeah.
get you on the calendar when you get back, and after you've, recovered from the wonderful trip. While you're still in the glow of how amazing it was, I have to get you back on the show. I think it'd be wonderful. I'm definitely going to make sure that the links to everything that Dr. Vincent Pedre does is in the show notes of today's podcast at learntoyourhealth.com. Dr. Vincent's book, Happy Gut, making sure the link is there as well. We should all get it for Christmas and give it to each other. What a great Christmas gift. Let's all give each other the gift of a healthy gut.
Sounds like a great idea.
Awesome. And of course, your website is happygutlife.com. You also have pedremd.com. That's PEDREMD.com. And
That's
all
my
those.
practice website.
Got it.
Yep.
Which, I see you hiring 5 nurse practitioners and maybe like 12 certified health coaches. You should just hire a bunch at once and train this whole team. It'll save you time instead of training
Well,
one person at a time. You should
guess
hire a whole
guess
team.
well, guess what? you're ahead of me, but I have I have already shot the video for, and I'm going to be rolling out probably Q2 of 2020 a health coach certification in happy gut.
Awesome. Well, you know what? I have a ton of health coaches as listeners, especially a lot of IIN graduates. I'm an IIN graduate as well.
Oh,
And
awesome.
so I know a lot of my listeners would be really interested because we have a lot of health coaches and a lot of holistic health professionals that are listeners that would love to take your course. So when
Can it
you come back and tell us about your trip, you'll also have to tell us about your happy gut
like
health coaching training.
yeah, so can I briefly end with a funny story?
Yes, please do.
Yeah, so I was just with my family in Washington D.C. for Thanksgiving, and it's my sister with my niece and nephews, and obviously the kids, a lot of their high school friends get back there. My niece is 25 years old, and so she was with a friend of hers, and she's raving about this book and how it changed her life and how she had IBS, and now she's followed the diet plan and it took away all her gut issues. And they're out at a bar, right? And she pulls out my book, and it's like it has notes and bent pages, and she's got markings everywhere, and she says, like, I don't never travel without this book. And she didn't know that my niece she didn't know that my niece was related to me, and my niece tells her, that's my uncle. because she doesn't, because it's my sister, she has a different last name, and so she says, my uncle's in town if you want to meet him. And she's like, oh no, I don't think I could handle it. I think I would faint or something. I thought it was so funny. I told her, yeah, if she wants to meet me, I'm in town. Like, but I thought, wow, that's why I did this,
Yes.
to help people that I probably maybe would never have the opportunity to meet, but to be able to change their lives in that way. That's why I did what I did.
Awesome.
And that's why I continue to do things like this and be on podcasts and interviews, because I just want to help as many people as possible.
Oh, I love it. That's my mission too. So we're right in alignment. We have a really active Facebook group, the listeners, the Learn True Health Facebook group. And I know that my listeners, after they get your book and they start reading it and loving it and writing notes in it and everything, that they'll start talking about it in the Facebook group. And we'll start having some wonderful discussions about it. Can't wait to have you back on the show. Thank you so much. This has been wonderful. I love this topic, and I can't wait to continue exploring happy gut and gut health and how to balance ourselves naturally in our next interview. And I can't wait to hear all about your trip. So have a very safe and very enlightening trip. And I can't wait to connect with you when you come back.
I look forward to it. Yeah, thank you.
Hello, True Health Seeker. Have you ever thought about becoming a health coach? Do you love learning about nutrition and how we can shift our lifestyle and our diet so that we can gain optimal health and happiness and longevity? Do you love helping your friends and family to solve their health problems and to figure out what they can do to eat healthier? Are you interested in becoming someone who can grow their own business, support people in their success? Do you love helping people? You might be the perfect candidate to become a health coach. I highly recommend checking out the Institute for Integrative Nutrition. I just spent the last year in their health coaching certification program, and it really blew me away. It was so amazing. I learned over 100 dietary theories. I learned all about nutrition, but from a standpoint of how we can help people to shift their life and shift their lifestyle to gain true holistic health. I definitely recommend you check them out. You can Google Institute for Integrative Nutrition or IIN and give them a call, or you can go to learntruehealth.com/coach and you can receive a free module of their training to check it out and see if it's something that you'd be interested in. Be sure to mention my name, Ashley James, and the Learn Your Health podcast, because I made a deal with them that they will give you the best price possible. I highly recommend checking it out. It really changed my life to be in their program, and I'm such a big advocate that I wanted to spread this information. We need more health coaches. In fact, health coaching is the largest growing career right now in the health field. So many health coaches are getting in and helping people because you can work in chiropractic offices, doctors' offices, you can work in hospitals, you can work online through Skype and help people around the world. You can become an author, you can go into the school system and help your local schools shift their programs to help children be healthier. You can go into senior centers and help them to shift their diet and lifestyle to best support them in their success and their health goals. There's so many different available options for you when you become a certified health coach. So check out IIN, check out the Institute for Integrative Nutrition, mention my name, get the best deal. Give them a call and they'll give you lots of free information and help you to see if this is the right move for you. Classes are starting soon. The next round of classes are starting at the end of the month. So you're going to want to call them now and check it out. And if you know anyone in your life who would be an amazing coach, please tell them about it. Being a health coach is so rewarding and you get to help so many people. Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic true health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.